It is a great satisfaction to greet you again. I hope you and your pet are well. Today we will talk about the following. How to tell if a dog has anxiety. Anxiety is a very real and common emotion that dogs experience. While it's hard to see them display distress, these feelings are normal responses to the triggers that cause them in the first place. While there are many causes of anxiety in dogs, these three are the most commonly diagnosed. 1. Separation anxiety. An estimated 14% of dogs suffer from separation anxiety, or an inability to find comfort when separated from family members. Separation anxiety occurs when a dog develops a fear of being left alone for a period of time. Dogs often develop this type of anxiety as puppies, during their senior years, or after a big change, such as a move, routine changes, or the addition of new family members or pets. Dogs recently adopted from shelters can also develop separation anxiety, although, paradoxically, separation anxiety tends to develop within 1 to 2 months of being brought home. Dogs with separation anxiety often display destructive behaviors, especially around the exit area and toward their owner's belongings. Other behaviors include house soiling, pacing, restlessness, inability to calm down, vocalization, and salivation. These behaviors likely begin as the owner prepares to leave or within the first 15 to 30 minutes after the dog is left alone. 2. Age-related anxiety. The aging process is associated with progressive and irreversible changes in body systems that can affect behavior. Aging dogs may exhibit a decline in cognitive function, including memory function, learning, perception, and awareness. 3. Fear-related anxiety. This type of anxiety is triggered by triggers such as loud noises, unfamiliar people and other animals, visual stimuli, and strange or new environments such as the vet's office or even a car ride. How can you tell if your dog has anxiety? What are the symptoms? Some of the symptoms may be occasional, while others are recurring and therefore part of a more serious problem. Monitor your dog's behavior and be proactive if any of the following symptoms occur. Aggression, house soiling, panting, drooling, shaking. Destructive behavior, excessive barking, whining, restlessness, depression, repetitive or compulsive behaviors, trembling while hiding, tail tucking, excessive licking or chewing. If any of these signs are present and you suspect your dog is suffering from anxiety, talk to your veterinarian. How to manage and treat your dog's anxiety. After diagnosis, it's time to find out how to help your dog live a normal, healthy life. Desensitization techniques and counter-conditioning are two strategies that can treat anxiety and fear. 1. Desensitization. Desensitization is achieved through repeated, controlled exposure to the specific stimulus that triggers fear or anxiety in the dog. If the stimulus is given in small doses and at a low intensity, the dog will hopefully not respond with fear or anxiety. An example is fireworks. If your dog has a phobia of fireworks, play soft fireworks sounds when you are home with your pet and he is in a calm state. Doing this repeatedly, while slowly increasing the volume over time, can help him become more accustomed to the noise, so he does not become anxious when he hears real fireworks. 2. Counter-conditioning. With counter-conditioning, the dog is trained to change his response to the anxiety or fear stimulus. Through positive reinforcement of the behavior, anxious or aggressive behavior can be replaced with a more desirable one. For example, teach your dog to sit or stay and reward him with a treat when he obeys. Then, when your dog is scared or anxious, you can redirect his attention back to you by asking him to perform one of the learned commands. Expectant parents can take a similar approach when preparing their dog for the arrival of a new baby. If they play baby noises in the background while they are at home with their pet, they will be able to get used to the new sound before the baby arrives. Alternative therapies, environmental changes, calming medications, and anti-anxiety medications may also be recommended. Depending on the severity of your anxiety, your veterinarian may prescribe anti-anxiety medications. It is a pleasure to inform you and help you. If you have not subscribed to the channel, you should do it now. Take care of yourself and your furry friend. A hug and until the next video.